I'm Jade. I am a women's health nurse practitioner, community health. I just have to start by saying that you guys are all inspiring and amazing. Listening to your stories not only help everybody in the community as to what to look for, but it helps me as a provider as well. And, really listening to our patients. You guys were all diagnosed with breast cancer before the age of 40. And so I think that's a big takeaway for me as a provider, and listening to your body and being consistent and speaking up for yourself. And thank you for sharing your stories. I think we all learn from them. Breast cancer is the #1 cancer for women worldwide. And breast cancer screening is really important in a lot of ways, not just mammograms, but self-breast exams. Mammograms, from the guidelines that we go by in women's health, you start at 40. So a mammogram starting at the age of 40 every year is what we recommend. If you have a strong family history of breast cancer, if you have a family history of prostate cancer, these are all red flags that you talk to your provider about with the suggestion that maybe you need to be screened earlier. Really, if you have any genetic history, if you have tested positive for the BRCA gene, if you have a family member who has tested positive for the BRCA gene, these are all conversations that you need to have with your provider so that you can get the adequate treatment that you need and the follow-ups and the adequate screenings. I talk to my patients often about self-breast exams, and I always say just know your breast tissue, be familiar with your breast tissue. If there's anything abnormal that you have any inkling like something ain't right, whether it be a lump, skin changes, thickening of the skin, discharge, nipple discharge, breast pain, or sometimes dimpling of the breast tissue, these are all red flags, and these are all reasons why you should schedule an appointment, follow up with your provider, and get the screenings that you need. Self-breast exams are really important, so are mammograms. And the other thing I like to talk about with my patients is lifestyle. So lifestyle is really important, to help mitigate your risks of breast cancer. Active lifestyles, healthy diet, well-balanced lifestyle, limiting your alcohol consumption, not smoking. These are all things that you can do in the community to help reduce your risks for breast cancer. But the bottom line, screening is important, mammograms are important, self-breast exams are important. And if you have any questions or any doubts about anything, don't wait. Go talk with your provider, schedule an appointment. And you guys are amazing. So as we were talking, I get a lot of patients that express concerns about getting a mammogram for the exposure to X-ray, to the discomfort of a mammogram. But really, a mammogram is a pretty straightforward machine that it doesn't really cause a lot of pain. It can cause a little bit of discomfort. It depends on your anatomy, but it is a low-dose X-ray, and it can detect breast cancer up to 2 years prior to you developing a mass. So there is a lot of significance behind the mammogram. I have a lot of patients that shy away from it because they're afraid of the pain. They hear stories that it's painful, but I encourage you to have that discussion with your provider and get your mammogram. So, if you're less than the age of 30, and you have any concerns about your breast tissue, we always suggest doing an ultrasound because the density of the breast tissue can be a little bit more than if you're 30 and above. And so if you do have dense breast tissue, yes, it does make it a little bit more challenging, especially with your self-breast exams, because you might feel a lump and a bump here and there. It might feel a little bit more grainy. And these are all just reasons to continue on with your mammograms and your self-breast exams. And if there's any changes, talk with your provider. Yes, implants, it's safe to get a mammogram with implants, regardless if it's above the muscle or below the muscle. It does not smush and it does not break. The people who do the mammograms they're aware of that, and they're mindful of those things, so they're not gonna torture you in that regard.